So, I would like to talk about Nafld today. And for anyone wondering what on earth that stands for, Nafld stands for non-alcoholic fatty liver disease. And by association, I will also be talking about alcoholic fatty liver disease, which abbreviates to AFLD, which doesn't sound quite as cool. And the reason that I'm going to talk about this today, one, it's my channel, I can talk about whatever I want, but two, the reason that I'm going to talk about this today is that this is one of the most prevalent things that comes up in my consultations for people who come to me who are at the end of the line, who've seen fuck knows how many doctors, health coaches, whatever, people to try to solve their issues and they haven't been able to get to the root cause of what's going on. And I'm not saying it's always fatty liver disease, but that's in the top three. And there's two reasons for this outside of why fatty liver occurs in the first place, which I will get to. One is that people don't test for it properly via an ultrasound. And two, they do test for it via an ultrasound and they tell you it's not a big deal and it's not causing you negative symptoms. And then unfortunately, these gentlemen spend months, years, hundreds, thousands of dollars trying to get to the root cause of what is going on with their body when in fact it was the fatty liver all the time causing these symptoms. Now, I've got a full masterclass on this where I prattle on for an hour with my friend Danny Bosser. You can check it out on his YouTube channel. I've also written a book which contains a much more succinct version of these, what I'm about to talk about, over a few pages. But I thought I'd just ramble on the topic a bit because it gives me a chance to talk around the issue a bit more than I got to in the book. The way that you test for fatty liver, and interestingly, there are some studies on the internet which completely refute this, but as someone who goes outside every day and looks up at the sky and can see it's blue, you can show me whatever study you like saying the sky is green, but it's blue. Bilirubin and fatty liver are absolutely associated, but there are caveats. One is Gilbert Syndrome, which I'll explain in a sec. But two is that there are plenty of guys who don't have elevated bilirubin who do have fatty liver disease. And they have symptoms and they have a history, typically of alcoholism or obesity or both, that were at root cause, in terms of a hypothesis at least, for causing this issue. So a bilirubin test and a whole liver panel while we're at it, particularly gamma GT as well, to see if the liver is particularly pissed off at the time, is extremely useful as a first foundation point for investigating whether someone does or doesn't have fatty liver, but it is not the be-all and end-all. Blood work is never the be-all and end-all of anything. It's a snapshot of that day. But it's still a useful tool in the toolbox, especially if bilirubin is jacked through the sky. And when I say jacked through the sky, let's say 30 plus. Or if the individual has had bilirubin consistently elevated every single time they've had their blood work done. Now, the way that you actually diagnose fatty liver, and when I say actually diagnose, I do have to throw the caveat in here before someone starts whinging in the comments like a little crybaby. I am not a doctor. So you can go and speak to your doctor about this, but good luck getting anywhere with it. The way that you diagnose fatty liver disease is via an ultrasound. And the reason that you get an ultrasound is that you can get a good look at it and see what's actually fucking going on in there. The blood work tells you may or may not there be a problem there. But the ultrasound will actually show you what's going on. So when in doubt, get an ultrasound. They're cheap, they're quick, they're painless. It's like checking if your liver's pregnant. And you get a report and it will tell you if you've got fatty liver or not. Ideally, it will tell you if it's mild or moderate. That's very useful for someone like myself. And hopefully, the radiologist will also note if the gallbladder ducts, the bile ducts, are obstructed, because that's also very helpful to know. So fortunately, fixing fatty liver is very easy. It's very cheap. It's predominantly painless, unless a small amount of liquid stool is particularly agonizing for you as a traumatic experience, which it's not. And it's something that you can resolve and actually clear up the insulin resistance and malaise which it causes, which if you don't actively fix it, it's never going to go away and it's going to impact your health and your quality of life for as long as you're on this earth. The 4 diseases of aging, cancer, dementia, heart disease, and obesity, are all impacted by insulin resistance. And every year, as more studies come out, we see how involved insulin resistance is in all of these things. Now, some people on the internet seem to believe that fatty liver can only be caused by being fat. But what the research actually does show, if you just spend 5 minutes going on Google and PubMed and looking at this yourself, is that in certain circumstances, fatty liver can actually be the precursor to the insulin resistance forming. But one of the tricky things that people have going on is if they are obese and they are trying to lose weight and they are insulin resistant, it can actually be very difficult to resolve the insulin resistance because the fatty liver is blocking the body's ability to actually burn body fat properly, and it's messing with the body's metabolism, and it's a very easy thing to fix. It's a roadblock that you can clear. And I'll tell you how to clear it. I don't sell any of this stuff. You can get it on iHerb, you can get it on Amazon. I do not care where you get it. Choline and inositol capsules. Now, a whole bunch of brands make them. I tend to use the Now Foods one. They come in a bottle of 100, but I am sure that all the big brands get them from the same factory, so you can get whatever you like. And they'll come in a capsule of 250 milligrams of choline and 250 milligrams of inositol. And what I have found works is if you take 4 to 6 of these capsules twice per day for 1 to 1.5 grams of each choline and inositol twice per day. So just to restate that so it's clear, 4 to 6 capsules in the morning, and again 4 to 6 capsules in the evening, ideally with a meal, but you can take it on an empty stomach if you fast, it doesn't matter. This for 8 to 12 weeks, assuming that you're not drinking alcohol over the period or taking a bunch of liver toxic pharmaceuticals like paracetamol and ibuprofen, will resolve the fatty liver disease, and you can get a follow-up ultrasound and you can see and make sure you got it all. If you didn't, take a month off and give it another crack. It's that simple. Now, I made a couple of statements in my masterclass with Danny Bossa on this that I would like to update and revise because I've treated a lot more fatty liver since then. And there's a couple of extra tips that I've kind of learned in the trenches that I'd like to share. I now prefer to augment this protocol with reduced glutathione or liposomal glutathione, as well as krill oil. Now, I don't think you need these for it to be successful, but what I have found is that these are very effective both in terms of mechanistic theory and actually practical outcomes in terms of just making people feel better in the short term, because the better people feel, the better habits they will tend to have day to day. Compliance is the science. And the better someone feels, the more likely they're going to go out and do all the shit that they need to do to get themselves out of the hole they're in. And when someone is obese or has a history of alcoholism, it tends to be better self-care. And you're going to be better disposed to better habits if you feel better. That's just the way that humans work. Willpower and discipline are finite. For a lot of people, there's a lot less in the tank. So I like reduced glutathione twice per day. You can get it from Jarrow, you can get it from MRM, you can get it from whichever brand you like. And I also like a gram of krill oil. I prefer the patented forms such as Neptune or Superbra. You can get them from Now Foods or Sports Research. Again, all of these are on Amazon. All of these are on iHerb. I don't have any affiliate codes in the description. You can Google it and get them yourself. So what a typical protocol would look like would be a gram of glutathione, a gram of krill oil, and 4 to 6 choline and inositol capsules twice per day for 8 to 12 weeks. And when I say 8 to 12 weeks and 4 to 6 capsules, one, you can have someone like myself, and again, I'm not trying to solicit my services. I'm booked out for ages. It would be better if you can find someone else to do this for you. Can modify the protocol based on your ultrasound results, or you can up the dose and up the period if it's moderate, or you can reduce it if it's mild. But what I would strongly recommend that you do is you get an ultrasound at the end to make sure that you did the job. And if it didn't clear out, do it again. The other thing I like to do at the end of this now, as an add-on to what I mentioned in Beyond TRT, as well as my previous masterclass, is I like to run 400 to, for some reason, some of the soft gels are 420, which I find hilarious, but 400 to 500 milligrams of phosphatidylcholine for the 6 months after you finish the protocol, just as a prophylaxis for keeping it from coming back. You don't need to do that, but I have done that recently with quite a few guys, and I have found that has been quite successful in preventing reoccurrence. And that's it. It's simple. It's a simple fix. And a lot of the time, this is the thing that's underpinning people's stubborn insulin resistance, or it's underpinning people's stubborn side effects on TRT. And that's it. Now, the last point that I will note is Gilbert syndrome. So if you have elevated bilirubin consistently and you go and get an ultrasound and it keeps coming back clear, it comes back clear, it comes back clear, it means you have Gilbert syndrome. And Gilbert syndrome is deemed some form of benign genetic condition where your body has issues producing and metabolizing bilirubin correctly. And it is deemed that it's a nothing diagnosis. It's like a smoke alarm going off for no reason. But when you look into what's actually going on with this, it does seem like this process is compromised. And what I have found is that guys with Gilbert syndrome react well to daily supplementation of glutathione. Again, reduced glutathione, you can take 500 milligrams 1 to 2 times per day. I do not sell glutathione, get it from wherever you like. There are also people, and I can already feel it in the comment section, which I'm not going to read, already arcing up thinking glutathione's not orally bioavailable. This guy's a fucking moron. You have to take NAC to increase glutathione. Everyone knows that. Read some studies on reduced glutathione and you will see that reduced or liposomal glutathione are effective for increasing serum glutathione. The reason I don't recommend high doses of NAC for this period is that it will irritate the gut mucosal lining in a lot of people. Now, if you tolerate NAC, fantastic. Use NAC. It's probably more economical. 1,200 milligrams twice a day, 600 milligrams if you like. But if you've been taking NAC and your shits have been a bit wild, consider that it's upsetting your stomach and you might tolerate glutathione better. And I think that it's just a better process overall to just take the thing that we're trying to increase at the end of the day when it does actually work. So that's it. That's all you need to know. Get your ultrasounds, get it cleared, look into it, and fix the fatty liver syndrome. Don't believe when you get told that it's something that you can't fix, that it doesn't matter, that it's not going to impact your health, when you know full well that you've got something going on. And that's an easy fix. It's a cheap fix. It's a painless fix. And it is going to allow you to live a better quality of life. One thing that I have found in terms of speaking to guys with fatty liver disease who've resolved it, and this is the analogy that I used in my masterclass with Daddy, is that it's like you were going through life 10% hungover all the time. And one thing that a lot of these guys noticed, particularly when they did develop it from alcoholism, is they started to notice that they started to get really brutal hangovers. So they'd have 1 or 2 beers and it would feel like they had 5 or 6 the next day. Or they'd have 5 or 6 beers and it would feel like they'd have 20 or 30. That's not the only symptom of fatty liver disease, but it can be something that can be a wake-up call for people to look into. And it can be something in hindsight that they go, oh, yeah, that did start happening. The other analogy that I used was from Dragon Ball Z, where Goku or Piccolo take off their weighted clothing and start to kick ass in the fight they're in. And that's what a lot of guys note too, is they say that it's like taking off weighted clothing that they didn't know was there. This underlying feeling of malaise, which is just basically feeling like shit all the time, just goes away. And they just get a better quality of life and a better sense of well-being. And that's because their liver is not weighed down and ineffective in doing what it needs to do. So if you're getting side effects from TRT, if you've got a history of alcoholism, if you've got elevated bilirubin in your blood panel, and you've never had your liver ultrasounded, it might be something that you should look into.